the Bill and Melinda Gates Institute for Population and Reproductive Health at Johns Hopkins University. I march for and with the next generation of leaders in reproductive health and family planning.
I march for advocates who speak up for more and better contraception.
I march for data that are accessible to policymakers.
I've been very lucky to live in the US with access to women's health, reproductive health, and education. And I march so more women in more countries have access to these same choices.
I march to empower cities to recognize and meet the reproductive health needs of young women living in underserved urban communities.
I march for advocates who work tirelessly to secure everyone's reproductive rights.
I march because all women and girls, no matter who they are or where they're from, deserve access to contraception.
I march for advocates who make the case to get family planning on the agenda.
I march for data that track progress in expanding women's contraceptive choice.
I march for progress and the freedom for women to choose a number of children that they wish to have.
I march for data that measures stockouts and method availability.
I march for data that evaluate equity and access to family planning services.
I march for advocates who garner political will to improve reproductive health policies.
I march for data that empower communities.
I march for women, migrants, asylum seekers, and refugees who are forced to leave their homes in search of a better life for themselves and their children.
I march for the use of actionable data to help local governments understand and address the sexual and reproductive health needs of women and young girls in their communities.
I march for data that inform reproductive health advocacy.
I march for women's equal participation in the labor market and the demographic dividend in sub-Saharan Africa.
I march for data that inform policy action.
I march for our partners who support leaders to become family planning champions.
We are the Gates Institute, and we march for family planning.